10 clinical questions that help new therapists get to the root of the problem. Hi, I'm Jerry Shaheen, LPC, NCC out of Missouri. When we're new therapists, it's easy to become fascinated with diagnosis, theory, and treatment planning. We spend years learning about depression, anxiety, trauma, personality disorders, different things like attachment, cognitive distortions, evidence based interventions. Then a client sits across from us, and our instinct is often to identify the diagnosis as quickly as possible. But one of the most valuable lessons in clinical practice is surprisingly simple. Before looking for a complex explanation, make sure the fundamentals have been assessed. Imagine a mechanic trying to diagnose a car that's just not starting. They inspect the ignition, the battery, electrical system, starter, the engine. After an hour of troubleshooting, someone then asks, "Did you check whether there's any fuel in the tank?" Sometimes the simplest explanation is the correct one. The same principle applies in counseling. Often clients often present with symptoms that resemble anxiety, that they resemble depression, or they look like burnout, maybe emotional dysregulation, or the go-to often is trauma. While these diagnoses may ultimately be appropriate, effective clinicians avoid jumping to conclusions before understanding the person's overall functioning and context. Evidence based assessment begins with curiosity, not assumption. Current counseling standards encourage clinicians to evaluate the client's biological, psychological, social, cultural, developmental, environmental influences. Oftentimes, agencies will call that the psychosocial assessment, looking at all the different domains of life before arriving at a clinical impression. This biopsychosocial approach, combined with trauma informed care, reminds us to ask what has happened to this person, what is happening now, and what strengths are available to support healing. Before identifying pathology, we got to assess whether the client's basic emotional, relational, environmental needs are being adequately met. So, why basic needs matter? Well, research consistently demonstrates that emotional distress it's influenced by much more than symptoms alone. Clients who experience chronic stress, social isolation, sleep disruption, financial instability, relationship conflict, discrimination, grief, maybe even limited coping resources, these frequently present with symptoms that overlap with common mental health diagnoses. Likewise, protective factors, including supportive relationships, meaningful activities, healthy routines, a sense of purpose, they improve resilience and treatment outcomes. So, as counselors, our role is not only to identify symptoms, but to understand the conditions that sustain or reduce them. Rather than asking only what diagnosis fits in this box, we also ask what strengths already exist, what protective factors are present, which needs are unmet, maybe what barriers interfere with recovery, what resources can be strengthened. These are the kinds of questions that move us from symptom management towards whole person care. We got to use a trauma informed perspective. Trauma informed counseling reminds us that behavior often represents adaptation rather than dysfunction. So rather than asking what's wrong with this client, this is the age old approach. We begin to ask things like what experiences may have shaped these responses? How's the nervous system attempting to stay safe? Which coping strategies once served a protective purpose? What does this client need to experience greater safety and regulation? This shift encourages empathy while also reducing stigma. Assessment doesn't have to feel like an interrogation. We got to look at it as a therapeutic conversation. Many of the most valuable clinical observations emerge through just natural conversation. We're so tempted to go through like a click through experience, but it's really more a natural conversation. Using techniques from motivational interviewing, person centered therapy, solutions focused brief therapy, and the like, therapists can gather rich assessment data through open ended questions, reflective listening, affirmations, genuine curiosity. If we're just asking questions to follow a workflow or a checklist, we're not going to be able to really get to the root of the matter. It's going to feel superficial. The goal is not to collect information just for information's sake, to enter something in a field or in a box. We really want to understand the client's lived experience. So let's go through 10 evidence based assessment questions. Who are the people you feel most connected to? What does this explore? It looks for their social supports, any type of attachment bonding, any sense of belonging, any protective relationships. Healthy relationships are among the strongest predictors of emotional resiliency. Number two, what has your sleep, appetite, and energy been like recently? This looks for biological functioning, possible depression, maybe anxiety or burnout, perhaps medical concerns. Changes in physical functioning, they often provide important diagnostic information. We can ask the client too, walk me through a typical day. This is number three, walk me through a typical day. This reveals their daily structure and routine, any behavioral activation, occupational functioning, isolation, maybe exposure to various types of risk or types of stress. Daily routines, they often explain more than just symptoms checklists alone. So, number four, what situations tend to increase their stress the most? This looks at triggers, environmental stressors, emotional patterns, cognitive themes. It helps guide our treatment planning by understanding um, what's going on in these situations. Number five, when life becomes difficult, what usually helps you cope? We're looking for coping skills, emotional regulation, or their window of tolerance, protective factors, risk behaviors. This identifies opportunities for skills building or skills development. Helps us see what skills maybe aren't there. Number six, what gives your life meaning or purpose right now? Purpose is a strong one. It associates with psychological flexibility, hope, motivation, recovery. You can find this in ACT, acceptance and commitment therapy. It emphasizes values as an important source of resilience. One of my personal favorites, acceptance and commitment theory, but tied in with narrative therapy. Number seven, we can ask, how much control do you feel you have over your life today, right now? This looks at self efficacy, it looks at empowerment, it looks at learned helplessness that might exist, or decision making. Clients who perceive greater agency often engage more effectively in treatment. Number eight, what strengths have helped you overcome challenges in the past, looking historically? This is a strengths based approach. Strengths based counseling reminds us that every client brings existing resources to therapy that we might not know about. Exploring resilience builds confidence while informing the treatment planning process. Number nine, what would you like in your life? What would you like your life to look like 6 months from now? This is vision casting. I don't like using, manifestation terminology. This is more visualization. We're looking for motivation, readiness for change, goal orientation, hope. It helps establish collaborative treatment goals. And then number 10, if therapy were successful, some people might not feel that it is right out the gate, but if, let's imagine it were, what would be different? Perhaps the most important assessment question of all is this question. It identifies client defined outcomes, their own expectations, what they value, and any sort of functional improvements that could occur. We're not assuming success, and we're not assuming that success looks the same for every client. We're allowing clients to define meaningful change for themselves. So, not to knock on new therapists, but new therapists often worry about finding the right diagnosis or selecting the perfect intervention. Experienced clinicians know that effective therapy begins with careful assessment. When we understand a client's biological health, emotional functioning, relationships, environment, strengths, coping strategies, values, culture, goals, the treatment planning often becomes much clearer, much richer. Evidence-based practices evidence-based practice is more robust. It looks at a lot more areas in the person's life. We can fall to a trap of which uh, framework are you using: CBT, DBT, EMDR. Instead, this involves integrating the best available research, clinical expertise, the client's own preference and lived experience. So, before searching for the most sophisticated intervention, we got to make sure we've assessed the fundamentals. What appears to be treatment resistant depression can be maybe profound loneliness. Sometimes anxiety is actually chronic sleep deprivation. Sometimes emotional dysregulation is actually just reflective of unresolved trauma. Or maybe burnout is mistaken for major depressive disorder. Um, like a mechanic, for example, like we mentioned earlier, who forgot to check the fuel tank, we discovered that the most important answer was waiting in the simplest assessment question. So effective counselors, we don't they don't rush to explain symptoms or symptomology. They remain curious long enough to understand the person experiencing them. I'm Jerry Shaheen. Thank you for taking your time today to look through those 10 questions that could be incredibly helpful in your assessment process to get to the root of the problem. Have a great rest of your day.